Hello, and thank you for joining us. My name is Ana Valentin. I am the CEO of Mejora Global, and with me is
Hi, I'm Dr. Melissa Radhe, and I'm the CEO of CASA.
Mel. And I have been working for about a year now together, a little over a year now together on making CASA grow. And we're very excited because we're at a point right now where we can take it from there. And my role as a consultant, I help Mel with her role as the CEO to steer the governance of the board in the right direction and make sure that we're doing what we said we were going to do with our mission. So we're gonna take this time to share some information about CASA because we're at a very exciting point in CASA's history, and we will hopefully answer all your questions. But if not, towards the end of this presentation, you will have all the information that you will need, and you will have also our contact information so that you can reach out to either Mel or me. I'm going to go ahead and forward the presentation. So today we're giving you information on how do you lead, serve, and strengthen our community. And for me personally, I have a very close attachment to mental health and recovery because of personal experience with my family. So I'm hoping that as you're listening to this presentation, something will also connect with you. The agenda for today will walk you through it really quickly. We don't have a lot of people on the call, but we know that some of you were expecting to have this reporting in your email once we finish. And we will skip the introductions. We've already done the introductions offline, but Mel will walk you through CASA's history, the mission, and the programs, and then we'll go back and forth and share other information that you need to have. We will also show you where we are as far as our strategic plan and our strategic goals are at this point, and then how you too can help us either identify someone who is ready to serve on a board or maybe on a committee, or if you yourself are interested, you can definitely reach out to us and we'll be able to interview you and get you all where you need to go. So Mel, are you ready?
Mm-hmm.
You are. I know you are. This is your part.
All right. So CASA has been around since 1987. We serve the community, historically underserved communities. So those BIPOC community members, those with lower SES status. So what we try to do is provide services to those who may traditionally gone with no services. So we offer a variety of clinical and non-clinical services. In Bridgeport is the majority of our sites, and then we have one in New Haven. We are also CARF accredited since 2002, so which means we have the highest accreditation for our level of services. So the first one are clinical sites. So we have a clinical residential treatment facility. So that means the clients can come and stay depending on their needs, anywhere from a month to we have one client that's been with us for a year, and that's residential treatment. So in that site, you get, depending on what level of care you are, anywhere from 5 hours of treatment a week to 30 hours of treatment a week. And it just depends where you are in the interim of your stay with us. So that's Casa Hostos, and that's actually our very first site that opened in 1987. That's where Casa started. Our other clinical site in in Bridgeport is called Project Courage, and that serves women who are either actively mothering or are parents, and they have substance use issues. It can be drug related, it could be alcohol related, and that is intensive outpatient services, and then they can step down to outpatient services. So depending again where you are in your recovery, that would deem how many days and how many hours you come to the site. From that program, we do offer childcare when our ladies are getting services. So having a child under 5 is not going to preclude you from being able to access services. Our third clinical site in Bridgeport is at Casa Hostos, and it's similar to our Project Courage, except it serves women and males. And it's, again, a step down from residential treatment, or you can come not through residential. So you can be referred from a hospital, self-referral, another treatment provider. And that, again, it just depends where you are in your recovery, how many days that you would qualify for services. In Bridgeport, we also have 3 housing services. So anybody who needs a little longer time to work on their recovery, we have Recovery House, and that is a 90-day bed. And in that program, we also have 4 18-month beds. So again, just depending how much services and what your specific needs are for that time. And then we have Arieto, and that is our permanent supportive housing. And that one, you come through the shelter system in Bridgeport or anywhere in Connecticut, but generally you would come through the Bridgeport shelter system. And that is for someone who is currently active in their recovery, and to further sobriety, you kind of hard to do if you're homeless. So this provides stability, long-term housing. You never have to leave if you choose not to. And then we have our Nova House, which is another transitional housing, and those serve community members who have HIV and AIDS who are also active in their recovery. And those beds, again, similar to Recovery House, you can be there several months, several years. It just depends where you are in your treatment. And then our last site is in New Haven, and that's our methadone clinic. So through the methadone clinic, we offer several different treatments for opioid addiction. So it just depends what the medical team and your medical needs are. The doctor would determine what would be the best fit. So that one is in New Haven, and that's outpatient treatment. So you come once or twice a week, you could come once or twice a month. It just depends where you are. And then we also have intensive outpatient treatment in that site as well. So again, depending where you are in your recovery, you would be able to come and access those day treatment services. Well, so it's a lot. That's a lot of information. So we offer lots of services.
It is a lot of information. It is a lot. It is a lot of information, and there are a lot of programs. One of the things that I do want to highlight is that, if I remember correctly, CASA was probably the first, or for a very long time, the only agency in Connecticut that was serving Puerto Rican and Latinos.
We still are. We are the only agency in Connecticut that serves monolingual Spanish-speaking clients. We're the only one. So our staff at Casa Hostos are fully bilingual. So the clients get their services in their native language, which, as we know, you can't beat that.
Yeah, it makes it, one of the testimonials that I saw in the video that I watched the other day, it makes it very comforting for someone to feel even more comfortable to come forward and ask for help, which sometimes
absolutely
with other agencies where there's a language barrier and the service becomes not accessible for that individual. So that
right.
makes groundbreaking for them, a groundbreaking space for them, because it's easier for them to approach someone and not feel judged and feel that connection immediately because of the cultural relevancy. The other thing is that, CASA, from what I've gotten to understand in the last year working with your team, Mel, is that CASA doesn't provide just the treatment. It's a holistic, it's the whole body, it's the whole person system. It's, whether you need mental health, you need a job, you need some kind of resource for training or whatever. You collaborate with your partners very well to make sure that person really receives what they need as far as services. I mean,
absolutely.
The end goal is to get them off the addiction, but there is a whole ecosystem of services that have to happen for that individual to get what they need.
Mm-hmm. And if there's a service that the client needs that we don't provide, we will find it for them. We will drive them to the appointments. We will wait for them. We will pick them up. We will bring them back. So if it is like a they need help with an ID or documentation or any of that, and we don't provide those services, we will get them to those services. So we try our best to be able to provide what it is that the clients need. And I think that's the beauty of CASA being a small agency as opposed to a larger organization. We do have the bandwidth to provide those really cookie cutter services that the clients need because, CASA also holds 16 clients. We're staffed around the clock. So we are able to provide very specific services to the clients.
And then you also have the LGBT community that you're also working with.
Absolutely.
So welcome. There's no judgment. Everybody
No.
can get treatment and service through CASA.
Absolutely. Yep. And then in our residential program, transgender clients, if we do have a referral, we will hold a room and have it just for them, their own bathroom. We don't want anybody to feel uncomfortable and not come to treatment because of sharing a space with someone else.
That's great. That's great. No, yeah, I'm very glad that that's happening because more and more I'm seeing it, but it's moving very, very slowly in that direction. So now that we got the information about the history and the mission and the programs that CASA is offering to the community, both in Bridgeport and New Haven, we're going to just talk a little bit about the fact that, where is my keyboard? The fact that last year, CASA engaged me to come in as a consultant and look at trying to do a marketing campaign for CASA, but then it turned out that we needed to build the house a little bit more to be a little bit more robust. And so we did a lot of work around board governance and policies and structure to really see where we were, because the plan that we had from a few years ago was not really meeting the needs of CASA as an organization and for their clients. And so last year we met with the board. The board received a board governance training in June. And then in September, I came in and I did a full day training, a board retreat, facilitated a full day board retreat with the board and with Mel. And we came up with 4 key areas that we needed to really prioritize before we even came out to the public. At the same time, my team also went out to the streets to find out what people thought about CASA, if they had even heard of it. And we found out that for an organization that had been in the community, rooted in the community for so many years, for over 3 decades, not everybody knew what CASA did and what it was all about. So it was kind of hard because this is at the same time when ICE is happening, deportations are happening. People were scared to talk to us. They're looking at people with clipboards out in the community. They're like not easy to trust. So, to have trust in us. So we were able to gather some information, and then that's became part of the overall strategic part. So I will discuss some of the points. Mel will discuss some of the points, and then we'll continue moving along. We went through, like I said, we went through the governance training with the board. We decided that we needed to, at that point, bring in new board members and strengthening the board, because we have had board members who have been on the board for many, many years. We have some board members who are almost, I don't want to say brand new now, because now they've been on the board for a little bit, and now they've gotten into a cadence and a rhythm of how things are working, how a board is supposed to be functioning, because this board, as loving as it is, it was working in very much 1990s, in a 1990s rhythm. And so we wanted to bring the board up to speed with, the nonprofit sector standards, and make sure that they're at the same level as other agencies in the same age group. And so we put together the four goals for the organization. And as you can see them on the screen, we decided to strengthen the governance of the board by bringing in new board members and committee members, diversify our revenue, and become stronger financially, become more transparent and inclusive in our communications. A lot of the language that CASA was using was very old and dated, and to today's standards, it would have been CASA would have been canceled a long time ago. And then we want to make sure that the programs that Mel just described are continue to be relevant to the community that they're serving. And so, Mel, do you want to talk about the revenue that in the progress that you're making on that?
Sure. So, as part of the strategic plan, one of the goals the board and Anna and I came up with that we identified was diversified sustainable revenue. So, the way CASA operates currently is that we have each of our programs have contracts with the state. So, the state will tell us, we will give you X amount of money, and this is how many clients you need to treat, and these are what the service outcomes need to look like. So, at any point in time, the government, the state can pull and say, we no longer have money to give you, to run a recovery house. There's nothing that we can do. So if we didn't have our own, a second, a third, a fourth source of income and revenue, we would have to close up shop basically. So part of the goal in the next few years is to come up with additional diversified revenue that if one day the state Demas comes and says, sorry, like we're closing up shop, there's nothing that we could do, we would still be able to provide services to the client. So we have, for the very first time in CASA history, a development and grant specialist. So she just started a few weeks ago with us, and so far she has been amazing in locating grants and different revenue sources for us. So that part, we really would need anybody coming on the board that has expertise to help guide us. My personal background is I'm a psychologist and a therapist, so fundraising and revenue is not my strong suit. I'm not ashamed to say it. So anybody that has any expertise in that area that can really help us and guide us is what we're looking for. And then, as Anna said, next year's our CASA's 40th anniversary. So with that, we would really like to get our name back out there in the community and, tell the community of this wonderful little organization that we are, and try, hopefully get some donors to establish some sort of funding that we're not only reliant on the state.
No, absolutely. And I think it's gonna happen. I think it's just a matter of getting the right people out to connect with the mission, because mental health and addiction recovery is not everybody's preferred mission to deal with.
Right.
It is part of the fabric of our communities, regardless of whether it's New Haven, Hartford, Bridgeport. It's still very prevalent. They Like I said, we went out into the community. We did a massive grassroots canvassing through Bridgeport, New Haven, Stratford, a couple of other towns, and we were able to collect information and data that really told us that even though some people knew about CASA, most people that heard about CASA thought that it was either a home ownership organization, it was a home improvement organization, it was a anything but a mental health or addiction recoveries agency. And so we were able to then look at what the materials have been for the last 30 something years, and now we're rebranding. So come August, we're going to have a whole new face for CASA, new logo, new colors, new voice, new tone, new message, because there's a lot of stigma that surrounds addiction recovery, and there's a lot of discrimination that comes out of addiction recovery. And so we want to make sure that the message is inclusive, that the message is uplifting and hopeful, because we want people to be able to come to the center and to the organization to receive the services that they need regardless. And so that's in the works right now. And we are looking for individuals who either will join a committee or will be able to serve on the board from that perspective, with a marketing background or a public relations background, someone who's really good at social media and adept at, managing online personas, because that's a whole different full-time job also itself. Updating the website, we can figure that out, but making sure that the right message is out there is really important. Mel, your turn.
Mm-hmm. So measurable sustainable program impact is our fourth priority. So we have been providing the services, as we said, for 4 decades almost. We are really trying to expand our services, catch a wider net. So we just closed about 2 weeks ago on a brand new property, and we're going to be expanding our mental health and co-occurring disorders. Again, still prioritizing BIPOC population, the underserved, those who cannot pay. We have numerous clients that don't pay anything for their services. We offer sliding scale and no fee. We will never turn anybody away. So with that, we're hoping that we can just reach more people that need these services.
Thank you. Thank you. So as you can see, we definitely have a lot of work to do. This is a 3-year plan that is supposed to end in 2028. However, you know that plans change along the way. Some things become priority. For the example, at this point, even though we did not we CASA did just purchase a building that's become a priority. It's kind of like a B priority as opposed to these 3 other goals within the strategic plan, because we want to make sure that we literally build the house or strengthen the house and the foundation to make sure that we can continue to grow and provide other programs in places that where it's needed. The next thing is that we want to make sure that you understand how you can help CASA. And there are 3 different ways. There's maybe a fourth one. There are 3 different ways you can help us by signing up and completing the application form so that we can screen it and see if you're a good fit for either a committee or a board member, depending on your availability and your capacity, because we don't want to add anything else on your plate that you're not able to do. The commitment is for 9 board meetings a year. I believe the terms are 2 years, every 2 years for up to 3 terms, and then you can get voted in again after a year break. You can serve on a committee and then move up later on once you feel that your training wheels have come off and you're ready to join the board. You can then do that as well. And you can also refer a leader like you who may be a good fit, who is looking at expanding their network and making sure that they're doing work that is meaningful in the community, someone that has the right character, someone who's willing to go the long way. Because, the one of the parts that I'm very adamant about this strategic plan is that we have a succession plan. Several of our board members are either in the retirement phase. Other members are, transitioning through life, life, period. Life is lifing at this point for many of us. And so, some people may decide to get off the board at one point. So we want to make sure that we have someone who can continue to execute on the governance of the organization and make sure that, Mel and her team are doing what they're supposed to do. The priority areas we're open right now. We have a number of seats available within the board, and we want to make sure that they come on board in September. So, it's important, but we want to be very cautious also about who we're bringing on board, because we don't want someone who is not going to be able to come to the meetings and contribute meaningfully and attend the events and be a champion and an ambassador for CASA. We want someone who will really be able to take on the lead with us and help us champion CASA forward. What else? I'm trying to think if there's anything else that I'm missing. I think I covered everything. I have worked with several nonprofits, and the breadth of personal contributions is up to open interpretation. Some people are like, we want to have 100% of the board giving, whether it's $5 or 500 or 5,000. Everybody has a meaningful contribution, meaning that doesn't equate the same to everybody else, but we want to make sure that board members are also able to contribute. I don't care if it's, $10 a month. I don't care if it's, $100 a month. That's up to you to decide, but we want everybody to decide, I am going to join the board and I am going to make a personal contribution. I have seen other boards where they right off from the beginning, they tell you it's $2,500 to be a board member. So you're basically paying for a seat at the board. And I think that's also a little extreme. So I want to find a happy medium in between the $5 a month and the $2,500 requirement that we need people to give. So the next message is what you will get through service. If you've ever volunteered, and I don't know, Mel, have you ever, well, you did the mentoring with the kids, and can you talk about your experience and what did you get?
Yeah. So Anna introduced me to Live Girl, a wonderful organization, nonprofit in Connecticut. And I went to one of their galas, actually. I think it was last summer.
Last summer.
It was yeah. And then I'm a mother of 3 daughters. I'm a immigrant myself. Didn't really have any mentors, no one that looked like me. And any space that I was in. So I really found their message to be beautiful and inspiring. So I started mentoring girls through that program as well. So I have mentees that I meet with once a month, and we just talk about nothing and we talk about everything. And it is, again, it's just a wonderful opportunity to give back. And I think it's purposeful for me because the mission spoke to me. It's empowering our future ladies. So I would hope whoever joined our board, the mission would really speak to them as well. Helping those who really just need a helping hand.
No, absolutely. And I think we have a lively enough group of people at Casa that I think it's because the way I think the culture at Casa, I'm not talking about the cultural aspect. I'm talking about the organization's culture is such that it's so welcoming and warm when people come in. It's like your family. You already are here. You're one of us. We're gonna, help you get through this. And I think that's the part that whoever comes on board is gonna get more so than anything else. Is you belong to something. You belong to a mission that's really rooted within our communities, especially in the Latino community. And Mel, I was telling you earlier that, it's so normalized that every weekend is a party scene in places like Puerto Rico. It's you go to one chinchorreo to the next chinchorro. The chinchorro is a little like a roadside kind of like bar watering hole. And so, you do that every weekend and it becomes normal within the culture. And so I think that, I'm saying that because it's mental health and addiction recoveries is part of our culture. It's not addressed historically and culturally. We don't deal with mental health, and it's looked at as, from older generations as what's wrong with you. And we need to
Right.
start staying away from that and encouraging our younger ones and people in our 40s and 50s and 60s to say it's okay to look for help, because it gets so stigmatized very quickly in a negative way that people shy away from that. So having that much effect within a mission or over a mission, it's really part of what you're gonna get as a board member when you join CASA. You're gonna be able to open the doors to things that into services that in the past have not been normal for our community. You'll also get, training, because we're gonna do a training. You'll get to learn about board governance. What does it mean to be a board member? How are you a good steward? What are your responsibilities? Because there are responsibilities. Sometimes people in organizations will ask you to join a board and they will not tell you, they will not even give you a binder with, policies, and this is what is expected of you. And this is, how we measure your contribution in terms of time and talent and treasure and all of that. So you get to grow through serving CASA, and then, you get to see yourself grow as a leader, which I'm hoping that we will get people who will come in at a certain level, whether it's just a board member at large or a committee member, and then move up to eventually becoming officers and staying within the organization for a while, so that, that is also part of your giving back to the community. At this point, we're thinking we can probably get 4 or 5 people on the board, maybe other people to fill the committees, like the marketing committee and the gala committee and all of that, and the fundraising committee. So we can talk about committees once we start talking to people one on one, because we want to make sure that we get to match their skills and align them to what it is that we're looking for. Excellent. So the next steps, this is going to be probably the shortest presentation I've ever met. The next steps are to either apply or to refer someone. You will get a copy of this recording in your email, and you will be able to watch it again and make notes as we're rambling and talking through the presentation. And, if you have questions, definitely get back to us. If you do apply, I want to make sure that you remember that we have 2 dates that are on the calendar that we want to make sure that you're available for. One of them is the board meeting in September, so that other board meetings, other board members can get to meet you. And then September 25th, which is a Friday, we understand it's a work day. So people will have to, if you're not retired, you will have to probably take it off from work. It's the board retreat. We'll do a half a day of board orientation to bring on board, and then the other half of the day will be spent on looking at the 4 goals that we shared with you earlier, to see if this still makes sense, if we're making any movement, if we need to change anything, because a lot has happened in a year at CASA, and we want to make sure that we continue to move in the right direction. So I think that's pretty much at this point for the bigger part of the presentation. We are going to open the floor to questions